name is Brittany. I'm going to be the nurse for today. Can you tell me why you're here at the hospital?
Yes, I've been not quite feeling well. I'm coughing a lot, and when I cough, a lot of thick mucus comes up. My heart is racing. I have shortness of breath, fever, chills, the whole combination of things.
Okay. And do you have any medical history?
Unfortunately, I've been diagnosed with emphysema and COPD.
Okay. So what we're going to do today is I'm just going to do an assessment on your chest and your back, okay?
Okay.
So the first thing I'm going to do is I'm going to look at the skin color. I'm going to notice any discoloration, any cyanosis, any lesions, and then I'll go ahead and make sure her spine is intact. And then I'll go ahead and look for a symmetric expansion, and I'll do that by placing my hands on the T9 and T10 level, and I'll ask her to take a deep breath. Okay. And when she does that, my hands should separate evenly, and they did, so she had symmetric chest wall expansion. The next thing I'm going to do is observe for tactile firmness, and I'm going to do that by placing my palm on her back and asking her to say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, and that will test for palpable vibration. And then the next thing I'm going to do is assess her lung fields, and I'm going to do that by percussing. And this is to check for any dullness. And I'm going to do it once on each side so I can compare. And then the next thing I'm going to do is I'm going to go ahead and percuss again, and I'm going to determine where the lung and the abdominal viscera separate. And when I determine that, I'm going to go ahead and mark it. So I have marked there, and then I go ahead and I do the other side. I go ahead and mark it, and then I'm going to go ahead and listen to her lungs. Okay, deep breath. Okay. And again, I'm going to do it once on each side so I can compare. Okay. And then I'd go ahead and look at the front of her. You can go ahead and turn. And again, I'm going to go ahead and look at the color. I'm going to look for any discoloration, any lesions. I'm going to look for symmetry. And then I'll go ahead and look for chest expansion. And I do that again by placing my hands right below her breastbone, and I'd pinch a piece of skin and ask her to take a deep breath, and I'd watch my hands separate evenly. And if they do, then she has symmetric chest expansion. And then again, I would go ahead and look for tactile firmness, and I would use my palm again, and I would ask her to say 99 and place them each on the different parts of the chest wall. And then I would go ahead and percuss again, and I would observe for any dullness. And then I would go ahead and auscultate her lung sounds. And that concludes the thorax and the lungs assessment.